Thank you so much. Good evening, everyone. Thank you all so much for joining us this evening for our Surviving and Thriving Breast Cancer Awareness Workshop presented by the Urban Health Initiative Office of Community Affairs for UChicago Medicine. Okay. So our agenda for this evening is a welcome, some housekeeping, introduction of our speakers, our workshop presentation, Q&A. We're going to also do a live raffle, and then we're going to close out, and there will also be surveys that will be put into the chat. But if you're unable to do the surveys tonight, you can definitely do them tomorrow. I will be sending out a recap for this evening's presentation, and which time you will be able to do the survey. So housekeeping rules really quickly. This is being recorded, so please keep your mics on mute. But if you need to ask a question, use the chat. But there will be a time throughout, once the presentations are done, where you can unmute yourselves and ask questions then. But in the meantime, if there's something that you need to ask in that moment, please feel free to use the chat. And then please complete the surveys for a chance to win a prize. And please follow us on social media. So our handles are UCM Urban Health Initiative, and we are on Facebook, Instagram, and on YouTube. So about us, we are the Urban Health Initiative, Office of Community Affairs, and we're Chicago Medicine's Community Health Division, responsible for collaborating with community-based organizations on health-related programs, research, and services for residents on the South Side of Chicago. And some of our programming includes health and wellness programs, healthcare career fairs, sponsorship events, WVON radio shows, which come on every Saturday at 1 a.m. 1 p.m. on AM 1690, community newsletters, fitness classes, and also volunteer opportunities. So our upcoming event, which is a great event, it's our high school healthcare career event, which we host biannually. And this is specifically for our 7th through 12th graders, and it's a chance for them to interact with our healthcare professionals to learn more about careers in the healthcare field, not just as being a doctor or a nurse, but also, we can learn about being other healthcare professional careers. And also they will have hands-on demonstrations in which they can learn suturing, stop the bleed, CPR, airway constriction. So it's an excellent event to bring the kids out to. You can also scan this QR code. And again, if you are unable to scan it now, we will send this out in the follow-up so you can scan it. And this event is taking place on Saturday, November 15th. So let's meet our speakers. We have Honorary Judge Tara B. Walton for Cook County Circuit Clerk. Judge Walton Judge Walton was appointed to the bench on June 25th, 2019, and brings over 22 years of experience as a persuasive litigator in the area of criminal defense. When not on the bench, she enjoys cooking, stepping, roller skating, mentoring, teaching, or serving in her church. Welcome, Judge Walton. Next, we have Ms. Beulah Brent, founder and CEO of Sisters Working It Out. Ms. Brent is the CEO of Sisters Working It Out, SWEO, an organization dedicated to eliminating breast cancer disparities in Chicagoland by educating and empowering women of color and connecting them to quality preventive health services. Throughout the many facets of her career endeavors, Ms. Brent has developed a strong passion for breast cancer awareness and community health. And we have Dr. Leah Goldberg, who is Dr. Goldberg is a senior resident in internal medicine at UChicago Medicine. She is originally from Northeastern Pennsylvania. She is passionate about the intersection of clinical medicine and public health. All right, so those are our speakers. I am going to stop my share and we're going to get started with Dr. Goldberg, who will present about breast cancer.
Thank you so much, Aisha. Hopefully you can see my screen. Is that right?
Yes.
Wonderful. Well, thank you all for having me here. I'm very pleased to be able to participate in this evening's discussion. And I'm here to talk about breast cancer awareness and to hopefully answer any questions that may be on your mind. As was already mentioned, I am a senior resident here at the University of Chicago, finishing up in internal medicine this year and planning to pursue oncology training after residency. So, breast cancer is the most common non-skin cancer. It is also the second deadliest cancer in women. And as you can see from this recent figure made by the American Cancer Society, breast cancer is very predominantly the most common cancer here in women, but is still present in men as well, with about 28,000 cases here. The screening for breast cancer consists of three main modalities: mammograms, MRIs, and ultrasounds. And I'm going to spend a large portion of my discussion sharing about what those screenings entail, why we do them, and what you could expect if you were to undergo any of those screenings. A question that patients often ask is how often they should be screened. And I can't get into that for everyone this evening because it is very variable from patient to patient, and it depends on a multitude of different factors that we take into consideration. So we're looking at risk factors, family history, and the physical exam when you come into the office. I'll be able to talk a little bit more about what we consider a risk factor and what we're looking for in family history, but this is definitely something that you should discuss with your physician, and you should encourage the men and women in your life to do the same. So, the first screening modality I wanted to discuss is a mammogram. I think that's one that is the most commonly known or heard of, but not all women know what to expect the first time that they go for a mammogram. So here I included a diagram of what the mammogram unit looks like. And you can see that there's a film plate, which is like a small table, where the breast is examined by placing an X-ray unit on top of it and getting an image of the breast in that way. And the reason that we do mammograms is because it is a very good way to get a comprehensive 3D view of the breast tissue, and it allows us to see masses within the breast in a way that other imaging modalities do not. So, for example, a chest X-ray, even though it uses X-ray technology, is really excellent at showing us the lungs, but the breast tissue isn't very clearly captured. So by using the mammogram and the X-ray in this way, we can get a much better view of the breast tissue, which is very important when we're looking for breast cancer. Another imaging modality that you may have heard of is a breast MRI. And again, I'm including a picture because it can be kind of surprising to women when they go for a breast MRI. Unlike many other MRIs or CT scans, when a patient expects to be laying flat on their back, in a breast MRI, we similarly are trying to capture as much of the breast tissue as we clearly can. And so, for that reason, the patient is actually positioned on their stomach, and there's an area that is kind of carved out for the breast tissue so that the machine can most accurately capture as much breast tissue as possible. Usually, breast MRIs come in after a mammogram has already been done, and it could be that there's something concerning on the mammogram that we can't quite see in its totality. And so the breast MRI is kind of an extra resource that we can use to capture more tissue and further identify suspicious areas. And then we have ultrasound. Breast ultrasound can be ordered on its own, it can be ordered in conjunction with a mammogram, or it can be ordered after something is seen on a mammogram or an MRI. The ultrasound can be helpful in localizing areas of concern, especially those that are closer to the skin. But a main way that we use breast ultrasound is actually if we need to collect a small sample of tissue via a biopsy. By using the ultrasound, we can see in real time where the biopsy needle is going, and we can more easily target, as you can see in this picture, if there's a lump in the breast that we want to get a tissue sample of. So now I'd like to talk a little bit about risk factors and what things we want to make sure we as physicians are asking you about, but also that you as patients can feel empowered to bring up to your doctor if you've never had this discussion with them. So, risk factors that can make anyone more susceptible to breast cancer is breast density. So, you may have heard the term or seen on a mammogram report dense breasts. What that means is that the tissue in the breast is very thick and dense, and that can increase a woman's risk for breast cancer in two ways. One is the evidence suggests that dense breast tissue in and of itself is more likely to have a cancer develop within it. The second reason it can put you at higher risk for breast cancer is because, as you can imagine, with each of those modalities that we just talked about, mammogram, MRI, and ultrasound, they do their best to capture as much of the breast as possible. But if a patient has particularly thick breast tissue, even a mammogram or MRI may not pick up a very, very small lesion because that tiny, tiny growing tumor can be surrounded by other dense normal tissue. And so, for those reasons, women with dense breasts are on a slightly different screening schedule, and we use slightly different modalities. Like, for example, we may incorporate ultrasound automatically in those women. Other risk factors are ones that are somewhat intuitive. So, family history, as you can imagine, if you have a family history of any disease, we always like to know that so that we can be screening you for that disease. So, the same is true in cancer. Whereas it's particularly relevant, which I'll get into in a little bit, is when it is a very close relative of yours. So we'll talk about that in a little bit. Age, your weight or BMI, body mass index, whether or not you've ever taken oral contraceptives, so birth control pills, can change your risk for breast cancer. And then alcohol use and smoking can increase your risk for many diseases, many different types of cancer, and can certainly put you at a higher risk for developing breast cancer. So now I'll talk about family history in some more detail. So, first degree relatives are the relatives that we as physicians want to know the most about and are the most concerned about. So, for example, if you had a parent with breast cancer, if you have a sibling with breast cancer, or if you have a child with breast cancer, those are the most important to alert your physician to. And even to the point where if you have a sibling that's diagnosed with breast cancer and you're not scheduled to see your physician for another year, you might want to call their office and let them know that, just so that we can make sure that you are up to date on all of your age-appropriate cancer screenings. Other relatives are definitely still relevant. So, for example, if you have an aunt or a grandparent that has breast cancer, has had breast cancer in the past, that's still important to let your physician know about. As I mentioned, breast cancer is most predominant in women, but there are many men who get diagnosed with breast cancer. And so I wanted to make sure to mention that today. If ever there's ever a male in your family with breast cancer, that is something to certainly let your primary care doctor know about. You may actually be referred to a geneticist, so a person who studies genetics, in order to see whether or not you are at an increased genetic risk for breast cancer. And then if you have any relatives who get diagnosed with breast cancer before the age of 40 at the time of their diagnosis, that's another factor within your family history that makes us more concerned about your breast cancer risk. I did want to take a moment to talk about self breast exams because the evidence for self breast exams has changed over time. And I felt it was important to bring it up because there are many women who come and report doing self breast exams, and then there are others who don't do breast exams. And I thought it might be a topic that is on everyone's mind. So, historically, self breast exams were recommended on a monthly basis for women to perform at home. The recommendation was to perform a breast exam in the shower around the same time every month to make sure that you didn't feel any new lumps or bumps. The studies and the evidence that has been done over the past 10 to 15 years shows that that might not be the most appropriate recommendation. And the reason that is that it led to many women undergoing unnecessary testing and even biopsies, which is invasive. And if we don't have to do something invasive, we would rather not. And so the evidence and the guidelines have actually shifted to say that there's not really as much of an indication for self breast exams and that they're not recommended. I would say I still have patients who feel more comfortable doing self breast exams, and I think that that's a very individualized and personal choice. If you do elect to perform self breast exams, things that I like to make sure my patients are aware of is that it's not only about feeling a mass, which you should absolutely report to your physician, but it's also important to be mindful of what the skin on your breast looks like. So there are different types of breast cancer, and some types of breast cancer can actually present with just skin changes of the breast. That can look different on different skin types. So any changes that you notice that are abnormal for you, I would encourage you to go to your doctor with that. It can be around the nipple area, but it can also be around the skin of the breast in general. And so if you see dimpling, puckering, color changes, anything that to your eyes looks different than your normal, something important to bring up to your physician. So this slide is really just to say self-breast exams used to be recommended, now they're not, but it's still, in my mind, a very personal choice. And if you ever notice a change in your breast, it's always better to tell your physician about it so that we can make sure that if you need any screening or imaging, we get that done for you. So how is the diagnosis of breast cancer made? Obviously, we have the physical exam, we have imaging, we've talked about that extensively. We mentioned earlier about the biopsy with the ultrasound. So what happens after we take a small piece of tissue out of an area of concern? That tissue gets sent to the lab where they prepare it on a slide that is put into a microscope. And pathologists or people who specialize in pathology, looking at tissue under the microscope, take a look and see what the tissue looks like to them. That is a whole other area of medicine and one that I am not an expert in, but they use their expertise to let the other physicians on the team know if it is concerning for cancer. They also are able to do different stains to look at the receptor status, which I'll get into in the next slide. And they can also let us know if there is a concern that requires genetic testing. So as I mentioned earlier, if you have any men in your family with breast cancer, talking to your doctor about genetic testing is merited. There are also other indications under the microscope that we can see that may prompt your physician to encourage you to consider genetic testing. So briefly, I wanted to talk about receptor status, and I found these two nice images to illustrate what I'm going to hopefully explain in a concise manner. The picture on the left is from a nice article about estrogen and progesterone receptor breast cancer. And so you may have heard of the term triple negative in the past. When we're talking about the three important receptors, we're talking about estrogen receptor, progesterone receptor, and then the picture on the right, HER2 receptor. So when we say that something is positive, it means that it does have a receptor on the surface of the cancer cell. And when something is negative, it means that that receptor is not present. So focusing on the picture on the left hand of the slide, you can see that there's the yellow receptor that's sticking out from the cell surface, and there's an orange dot that is binding into that receptor. The orange dot is meant to signify estrogen or progesterone, the hormone. And then when it goes into the receptor, that joining activates the cell and tells the cell to continue dividing. That's obviously a problem in a cancer cell because the last thing we want is for the cancer cell to get a signal that it should keep dividing. Where the receptor status comes into play is that there are different therapies, different medications that can actually block those receptors. So in the red box on the lower left-hand side of the screen, you can see a blue dot binding to that receptor. And that is a medication that is given to bind that receptor and block the receptor from working because it's blocking the orange dot or the hormone from binding and activating the cell. So, what this is trying to illustrate is that when we block the receptors that tell the cell to keep dividing, that's a way for us to treat the breast cancer in conjunction with other modalities like surgery and radiation. On the right-hand side, it's the same principle. It's just showing that a normal breast cancer cell does not have a ton of receptors, and that a HER2 positive breast cancer cell will have all these extra receptors that show that it is positive for all of those extra HER2 receptors. Similarly, if we can block the HER2 receptor from stimulating the cell to replicate, we can effectively offer a treatment for the breast cancer. The reason that triple negative breast cancer has in the past been more difficult to control is that when we don't have these targets, we have fewer tools to adequately treat the breast cancer. But luckily, there are other developments that have been developed recently to target triple negative breast cancer, and the 5-year survival rates for triple negative breast cancer are starting to improve, which is encouraging. So, to summarize the treatment options for breast cancer, there's surgery, radiation, chemotherapy, and then sometimes after breast cancer, you're put on an oral medication to reduce the risk of the cancer coming back. So these are the references that I use throughout the presentation. I just wanted to make one more plug that early detection really does save lives. Obviously, breast cancer predominantly affects women, and unfortunately, 1 in 8 women are affected in the United States at some point in their lifetime. And also, men can be affected by this cancer as well. And so, please encourage all the women and men in your life to talk to their doctor about what type of screening is most appropriate for them, and encourage them to seek medical attention if they see any changes in their breast or breast tissue. I hope that this was helpful, and I'm happy to answer any questions that this has brought up for you.
Thank you so much for that wonderful presentation, Dr. Leah. Yes, and if anyone has any questions, please feel free to drop them in the chat. We will have time where you can actually, verbally ask the questions, but yeah, we just want to keep the presentations going. So again, if there's something that you wanted to ask, please feel free to drop it in the chat. And we are going to get moving with our next presenter. Initially, we were going to have Judge Walton, who's a breast cancer survivor, on, but unfortunately, she had an emergency matter to tend to, so she is not on the call as of yet. She may join us, but as of now, she's not on. So we're going to send it over to Ms. Beulah, who can get us started with her presentation. And again, thank you all for joining us this evening.
Okay, we're going to have to tell the judge we're not happy with that, right? But
Absolutely.
I do want to say, Dr. Goldberg, I love that presentation because it was so simple for the community that we serve. So, Alicia, I have to have her information so we can get her to speak at some hours because I thought, her presentation was just so basic where I think a lot of our clients will love to hear things like that. So thank you for that presentation. So again, my name is Beulah Brandt, and I am the CEO for Sisters Working It Out. Sisters Working It Out was actually founded in 2001 by Dr. Monica Peak. And as you guys might know, Dr. Monica Peak is a physician at UChicago. Dr. Peak stepped down. I stepped up. I've been the CEO since, and I think Dr. Peak and I are the only original that still serve as on Sisters Working It Out. So I'm happy to say I love just continue the work that we started back in 2001. Um, so one of the things I want to talk about, Dr. Goldberg, all the things that you just talked about is what we are out in the community doing right now, making women's we'll want them to be more educated in making decisions on whether they're going to get that mammogram or not. And I think the most difficult things for us is basically when women get their mammograms, is basically talking about how difficult they make other women afraid to take it because they talk about the pain of having a mammogram. So one of the questions that I have when women would come back and tell us that they are afraid to take it because of what they heard. So my question to them is, how many of us have birthed a child? And when they raise their hand to say they birthed a child, then my next question is, did it hurt? So, so that means that if it hurts that time, you're going to hurt for the rest of your life because, you got to deal with your kids. It's going to take 3 seconds and it's over. So those are ways that we can kind of talk women off the edge to get those mammograms. I also started, and how I got involved with mammogram is working at Cook County Hospital. And I was in the mammography department at that time. And Dr. Pete was actually working at Rush at that time. So we actually combined our resources to find out why the disparity, because the disparity at that time was at 62%. So, and it was really hard to get women of colors to get their mammogram. So by working together and then working with the community, with other not-for-profit organizations, that's how we was able to come up with finding ways to make sure women get their mammograms. And then that's how we start to partner with Rush University to get some of the women that needed mammogram from Cook County Hospital. So that's how we started that partnership to make sure that we can work with also other community-based organization, combining our resources, going out into the community and using ambassadors. One of the things that we just recently did, Alicia, I heard you earlier talking about the class that you have coming up with the students. And what we decided to do is to actually start to work with young youth. So we just start to work with the GEMS. GEMS is basically an organization with youth 13 and up. And I thought it would be a good idea to say, how great it would be to teach our children the importance of learning about their bodies, and not only learn about their bodies. How do we encourage them to get their sisters, their brothers, or their moms to get their mammogram? So we just started this, I think, about 3 months ago. So we're in the process now of making sure that we're starting classes to teach the youth about the importance of self-breast exam and advocating for themselves. That's one of the things that we find is an issue with a lot of our patients, that they don't understand the shared care between their doctors and themselves. A lot of our patients basically say, whatever my doctor say, that's what I'm going to do, with no questions asked. And I think that, as an educator and as an advocate, it's our job to teach them to ask questions so we can do shared care. We want women to be involved in their health. That way they're not waiting on their doctors to do what it is that they think they should be doing. One of the other things that I do not talk about much, and there's no reason why I don't. I guess I've been into breast cancer, and I talk about cervical cancer. Those are two other things that we actually focus on, even though we are a women's health organization. Whatever the issue might be, if it's pertaining to a woman, we will actually deal with it. We'll find the resources and help women to get the services they need while they're going through. So we also, partner, and we're just so blessed to be able to partner with UChicago. And what makes it really important to me, I serve as the co-moderator for the University Comprehensive Care Center. So to be able to have those contacts, to be able to reach out to the team when we're having problems with some of the patients that we serve that need that second opinion, or when we're trying to send patients to get those mammograms, Dr. Goldberg, that you're talking about, that they might feel that lump, they might be afraid, but with your wisdom program, that help us a lot to get the patients in and get them out. and then you know what, enter them into those clinical trials, into those clinical trials and genetic testing. And we have had several people to come there who just love the service and talk about how you guys make them feel when they come in to get their services. The other thing that I started to talk about that I kind of skipped around was one of the other things I wanted to talk about was cervical cancer. In 2023, I was diagnosed with cervical cancer. And because I knew the things that I should ask my doctor, I knew the signs and symptoms of what I was going through. I knew I was postmenopausal. And for me to try to get an appointment with my doctor's office, the problem was that the receptionist basically it was back in February. She told me they didn't have anything, no appointments until July. Where I knew July, February to July just wasn't going to be the answer for me. So, but she was persistent as well to make sure that I didn't get that appointment. So the good thing is I have my doctor's, I had my doctor's phone number on speed dial, right? So I called and said, girl, you won't believe I can't get in. And, I kind of told her the story. That was on a Friday. On a Tuesday, I was in. She sent me in to get all the tests that I need. The funniest thing, though, Dr. Goldberg, my pap smear came back normal, but she did a transvaginal ultrasound, and that's where they found that it was malignant. So I think a month after that, then I had a full hysterectomy, and the good part is I didn't according to the pathology report, I didn't because I caught it so early and I was persistent and making sure I got the right care, I didn't need radiation or any chemo. So it wasn't recommended because it was contained and where they found it. So that I found to be the best thing that I knew that having these classes, working with professionals, talking about the symptoms, what it is that we should do, how do we advocate for ourselves. I contribute that to me being alive today. And more than ever, I have that is my passion, is to be able to walk women through what it is they're going through, making sure they're getting a ride to and from their appointments. We offer free transportations for patients who need that type of services. So that way, with the stress, it doesn't help. So we try to find ways to make sure patients have less stress than they have to go through. So providing that ride has really worked out for the patients that we serve. So those are some of the things that we do in the community. I know we have, and one of the other things we're having is patients not feeling good about themselves, they're depressed. So we also connect them with mental health services. Younger women who said they don't feel attractive, to their husband, their boyfriends, or whomever. We started what we call a day of beauty. So during our day of beauty, we actually have professional, such as Dr. Goldberg's. We have survivors, we have caregivers to come in and talk about what that feels like. So yes, we tricked them a little bit to come in to get the education, and then after we get the education, we go in and we do new wigs. We take the time in October to provide to do a campaign to raise new wigs. Um, the clients will be able to get haircuts if they don't want a wig. They're going to get a mini Medicare, also a massage. So all the things that make them look good, feel better, we're going to be providing at this event. So we hope they're going to come in and enjoy that service. We'll be working with Mariano's. We'll be working with UChicago, Northwestern, as well as UIC to provide all the services that we feel that we need. Anybody else that might be able to, want to check out their kidneys. We're going to be working with the National Kidney Foundation to offer that service right there on the spot. Those are things that we do at no cost to the communities that we serve. So I look at myself. I tell people all the time, let us help you before you need us. So that's my motto, and that's what I feel good about being able to share what it is that we do in the community. Not only that, we actually, I see we have quite a few of our volunteers on the line that's actually doing their CHW program from UIC from Miles Square. So I'm happy to have them on the line so they can get more education on what they're doing in the community before we put them out in the community. So I'm so grateful for all of them that's on the line to support what it is that we're doing. And Dr. Goldberg, I hope I've been teaching them well because they saw all your slides now. So you kind of put me on the spot there, but I think I've been doing pretty good. It lines up with everything that you told us tonight. So I appreciate them joining us tonight. So Alicia, thank you so much for inviting us to be a part of this presentation tonight. And we look forward to continue to work with you all. So thank you very much.
And thank you so much for sharing the information about Sisters Working It Out. For everybody on the call, I will definitely provide information on how you can get in contact with Ms. Beulah and find out more about this wonderful organization. She has been a partner with us for many years, and we're just looking forward to continuing our work with her. She's an amazing person, and I'm thanking you for being here. And so we do have our last presenter who is here. We have Judge Tara Walton, who will give us her story. Thank you so much for being here. We appreciate you. And I'm going to turn the mic over to you.
Well, hello everyone, and I apologize for being late, but I had radiation today.
We appreciate
So
you.
I am in the middle of surviving. I did all of my chemo. I did 4 months of chemo for breast cancer, and then I've done my surgery and was declared cancer-free about a month ago. But I still have to do the radiation as a final level of coverage. So it has been quite the experience the whole year. I got a diagnosis in January. So I'm doing fine. I'm back at work. And today was day one of radiation. So very scary. But now I know what to expect. So I'm ready for the next 20. I have to do 21. But as far as who I am Judge Tara Walton. I'm a circuit court judge over at the Criminal Court Building, 26 in California. I've been on the bench 6 years now. And before that, I was a criminal defense attorney. So I'm actually at work today engaged in a murder trial that's been going since Monday. So I left early so that I could do radiation. Um, um, what else? I don't know what else I can tell you. Regular girl, born on the low end, lived in Inglewood for a very long time, and God is blessing.
Absolutely. Thank you for that. Can you just share a little bit of your story as to when you found out or how you found out that you
Sure.
had cancer?
Okay, so it was a routine mammogram. I didn't have any symptoms at all. I didn't have a lump, didn't have any discharge, was feeling fine, perfect, regular. And I went in for a mammogram and it just looked different than the one from a year ago. So I did a repeat in a diagnostic format, and my doctors were still uncomfortable with the way that it appeared. So I did a couple of more things, and then the final step was the biopsy. The MRI kind of determined that I had something, and then I did the biopsy, which determined that I had breast cancer. So I was diagnosed with HER2 positive, and if you know anything about the different types of breast cancer, that is one of the most aggressive one. They said that I was a stage 2. I had a 2.1 centimeter tumor, grade 3, highest risk because it had the potential to spread more rapidly than anything else. When I asked about how fast it grew, to give you an idea, it would grow a tenth of a centimeter every day. So they required that I do chemo first because I was going to opt to just do a double. But they said do the chemo because even if you did the double, you still have to do the chemo. So I did chemo first, and I had what they call a perfect chemo response. The chemo shrank my tumor down to nothing. So by the time I got to surgery, I only had scar tissue. So my surgery was about 5 hours. They took out the scar tissue. Then they removed some lymph nodes, even though I didn't have any lymph node involvement, but just to be on the safe side. And so after they sent everything to pathology, they all came back clear. but I still have, radiation is still mandatory, so I have to do 21. But the mammograms are crucial, because like I said, I didn't feel anything and I wasn't sick at all. Once I did chemo, I was sick as a dog. I was sick, 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 sick for the entire 4 months, plus about another month and a half after. I was just sick. Today, radiation felt like nothing. So hopefully that'll be the process and I won't feel it, other than being a little nauseated.
Okay, thank you so much. And again, I
Yeah.
appreciate you even, taking the time out after having to go
Mhm.
through chemo today. I just
Yeah,
appreciate
I did radiation. Oh, and then
radiation.
I still have to do medicine for a year,
Okay,
immunotherapy. So I have to still come to the chemo center and be traumatized for a whole year, every 3 weeks, to get this one medication in my port.
okay.
So, but I'm doing great.
Well, you look great, and I
Thank you,
appreciate you.
sister.
I can't say it enough. I appreciate you for being here. I saw Tara recently at the Sister Strut Breast Cancer Walk, and she looked amazing, just out there doing her thing. So, again, I thank you
Yeah.
for being here this evening. We are going to open it up to questions for our panel.
Thank you for having me.
Yes, thank you so much. We have a question from Deborah Moore. You'd like to take yourself off mute? You definitely
Hi,
can.
Judge Walton. Hello. God bless
Hey,
you. I'm so happy to
hey.
hear about your your survivor and thrivership, because that's what you're in right now. I have a
Absolutely.
question. Did they mention anything about breast density when they first suggested that you come back for your screening when you had your mammogram and they didn't like the way it looked? Did they say anything about your breast density?
Nope. That's why it was so urgent, because I don't have dense breast. And so
Ah,
when they seen the fuzziness, they knew that it was something. But when you have density, it's very hard to see, because I have friends
right.
who have dense breast and you can't see it. So,
Okay.
no,
I was just curious. Thank you so much for sharing your story.
thank you.
Okay, we have Kim Green who has a question. Go ahead, Ms. Green.
Good evening. Thank you for the invite, Aisha. I had put a question in the chat. I have a niece who I just found out, I think about a month ago. She's 38, working, has two jobs, actually works anyway, for a hospital, but she has it's not a job that provides her with insurance. And I learned that at 38, after she has two children, but after that she doesn't go for mammograms and for gynae checkups, and I was shocked. And so for those who don't have insurance, what do we tell them? What do we tell our young people? And I don't know if she doesn't think she has a scare because she's 38, but and there's no history in our family, but I was just shocked. So for non-insured, what do we tell them?
I'd like to take a step at that first, Dr. Goldberg and Ish. And so we do work with hospitals to get them insurance. We do have what we call IBCCP program. That's an Illinois insurance, right? So we use that. I'm sorry, we use that to actually send, and we work with FQACs to actually get women's in. And because she's not 40, that means she's going to have to see a doctor before she can get that mammogram. So any patient without insurance, you can always send them our way. We work again with the University of Chicago. We work with UIC as well as Northwestern to get those patients in. So it's basically how can we get them in? What type of insurance? I mean, if they don't have any insurance, that's what the wisdom studies help us with at the University of Chicago. And with UIC and our FQACs, we can always put them in touch with someone that will help them. So, but let me just say this as well too. On the 28th of next month, if you don't mind, Isha, I would just love to say this. If we have anybody on the line that's 40 and older, Bears Care is actually doing mammograms for women who have never had a mammogram before. So if you know anybody with no insurance or with insurance and just never had a mammogram, if they get in touch with us, we are able to actually help them get those mammograms. So there is no issue when patients do not, as of right now, there is no issue with patients not having a mammogram because there is services out there to provide those mammograms.
Thank you. So I'm not, what do I, so she's not 40 yet. So what do I tell her?
So we also connect them with a provider as well. So that because she's not 40, she needs a PCP. So I know you said she hasn't been going to the doctor, but at some point, you said she also have kids. So that means that she's been seeing somebody. But and we cannot go on your concerns. We literally have to have that patient call us so we can actually talk to the patients and work with the patient to make sure it's what she wants because we have a lot of family who actually connect us, call us, give us the information. And one of the patients told me she really appreciate all the wonderful work that we've done. But one of the things that she didn't appreciate is that a family member put her out there but she
Mhm.
took my number and said if I need you, I'm gonna call you just because you was nice enough to call me. So we want to be able to do that. And again, I see someone putting some answers in the chat. So more than myself have some answers. So please check out the chat and anybody else who wants to gives that advice, please feel free to do so.
Thank you.
Okay. Did you have something, Dr. Goldberg? Or
I was just going to echo the point about the wisdom study, which I know is ongoing nationally, but at the University of Chicago, we use that a lot. That does apply to women over the age of 30. And then I would also just say it's likely that she is due for a pap smear, especially if she has never had one. So getting her connected to a primary care physician is really the most important step to make sure that she's up to date, not only on her age-related health screenings like cancer screenings, but also any age-appropriate vaccinations and other routine primary care testing. So definitely encourage her to do so.
right, thank you all. Thank you all for those responses. And also, if you haven't checked the chat, My Access Health Network has a program that charges based on your income, and their network work uses Mount Sinai Hospital. So that's something to check out, My Access Health Network. Okay, so are there any additional questions?
I had a question that was sent to me that I will read and answer for the group. So someone had asked, it seems that the ultrasound may be a follow-up to a regular mammogram, but why not have the ultrasound be first in the sequence of exams? And that's a great question because ultrasound is often less uncomfortable than mammograms. And the reason that that's not the way that the screening recommendations are structured is because, as you can imagine, the ultrasound is much more easily able to see different areas of the breast because it is compressible against the breast and there's more user ability to access the entire breast when you're examining via ultrasound. And so what studies have found is that actually that leads to more false positives. And as I was mentioning earlier, similarly with the self breast exams, the reason that's no longer recommended is because that whenever there are more false positives than true positives, we ask, is this test really helping, or is it causing patients to undergo more invasive testing than they would otherwise? And so the best guidelines that we have currently is to start with a mammogram. And if there's an area on the mammogram that is particularly concerning and we need further characterization, we consider ultrasound, especially for ultrasound guided biopsy, or we consider breast MRI depending on the individual clinical context. So that is a great question. the ultrasound first model is not the current recommendations, but I will say that if you go to your physician with another breast problem, there are other contexts where we do go for ultrasound first, specifically for infections of the breast. So in women who have recently had a baby and may be concerning signs of a breast infection that will sometimes merit a breast ultrasound. And there are other particular contexts where your physician might order only a breast ultrasound or start with a breast ultrasound. But for the general public guidelines, the recommendation is to start with a mammogram.
All right, thank you so much. Quick question. Can you, Dr. Goldberg, can you describe what symptoms a man should look for? Or if he's having specific symptoms, that could possibly be breast cancer. Can you describe what those may be?
Yes, absolutely. So, males can absolutely have breast cancer, and it's important that they're aware of that risk so that they know signs to look out for. So, similarly to women who notice changes of the breast, if there's any type of new lump or bump that you appreciate, pain in the breast, pain is less common. It's more often a painless mass, but if you have pain in the breast, that's notable and worthwhile to speak to your physician about. Any changes of the skin overlying the breast, any discharge from the nipple, or changes in the nipple structure are all reasons to alert your physician. Breast cancer is much less common in men, but that does not mean that it doesn't happen in men. And so making sure that all of the men in our lives are aware of that risk is also very important.
Okay, great. Thank you so much. Um, Judge Walton, if you are still available, just quickly, do you
I
have,
am still here. I'm still
very
here.
good, very good. Okay, really quickly, do you have a family history of breast cancer?
Not at no, not on my parents' level, but I do have cousins who have it. So there were three of us with it at the same time, all on my father's side. Oddly, so what I did was I did the genetic testing. They used to just test for the BRCA gene, but now you can get tested for about 85 different genes. So I did that for the benefit of the other women in my family, and I tested negative for all of them. But I did have that information to at least share with my family so they'll know that that's not a thing. So they pretty much said it was just bad luck. It wasn't anything that I did. It wasn't a genetic thing. It was just something that happened.
Gotcha. Okay, thank
Mm-hmm.
you for that.
Mm-hmm.
We have a question in the chat. Should a woman be concerned when their breasts itch? Is this a warning sign of breast cancer?
That's a great question. So often for women with larger breasts and breast tissue that kind of obscures the area of the chest wall, you can develop moisture and even a fungal infection under the breasts. And so it's not uncommon for women to feel like the skin around or under their breast is itchy for that reason. That's not necessarily something that's particularly concerning, but if it is the skin on top of your breast and you notice any changes in the skin, so earlier I mentioned dimpling, that is a common one that we are concerned about, or if there's discharge anywhere on the breast. So skin breakdown and discharge would be concerning. That would be more concerning for a cellulitis, like a skin and soft tissue infection. Itching in and of itself, I would not say is a warning sign of breast cancer, but if it is not just because you have moisture under the breasts and have kind of common itching under the breast, and you're noticing a new area that is itching on your breast, and especially if it's only on one side of the breast and it's consistently only on one breast and not the other, that would be something that I would talk to your physician about.
All right, thank you for the questions. If you guys have any additional questions, feel free to unmute yourselves, or if you want to continue to put them in the chat, please do so. But again, thank you all for joining and for participating and just, being here. This is such an important topic. Every October, we definitely, spotlight this condition. We're going to continue to do it always. We're going to, just because, again, it's something that we need to know. It's something that we need to pass on to our family members. It's something that, it's very important. And I just want to keep enforcing that. I have been a breast cancer advocate for many years and will continue to do so. I have not had breast cancer, thank God for that. However, I have many friends and a few family members who have dealt with this. So I'm very much aware and, just very, it's very near and dear to me. So I'm going to continue to be an advocate and continue to bring these types of educational sessions to everyone, and hope that you all share this out. Again, this is being recorded, so please share it out. It'll be posted on our YouTube page as well as our Facebook page. So rewatch it, share it out. Just it's information that's so needed. So Ms. Moore, I see that you put a website out for
Someone had
this.
asked what's the name of Miss Beulah's group, so I just put the website on there
Oh,
for.
okay, for Sisters Working It Out. Thank you so
Yeah.
much. And I also, in the follow-up email, I'm going to share that out so that everybody on this call can have the information to get the learn about Sisters Working It Out, Miss Beulah's organization. So I'll share that out along with the survey. So
Thank
are there any additional questions before we head on to we're going to do a live raffle. But before we get to that, just want to open up the floor again for additional questions before we turn it back over to our panelists to do final closeouts.
I just wanted to add one other detail, if that's okay.
Sure, absolutely.
So just one other thing to specifically say about breast itching is that if it is itching of both breasts, but it is localized to the nipple, then that can be concerning. So normally, if the itching is only on one breast and not the other, that's concerning if it's like not on the nipple. But if it is both breasts and it is localized to the nipple, that is something to bring up to your doctor. So I just wanted to make sure that that was clear and that everyone was aware.
Thank you for that. And I also, now that you mentioned that, someone had a discussion about thinking because they were dealing with breast itching and it's something that's new, and she is going through perimenopause, and she was attributing that to the possibility that this is yet another symptom of perimenopause. Could that be something that's related to perimenopause?
I haven't heard of breast itching being a manifestation of perimenopause, but I will say that I have had patients who attribute something, any symptom to perimenopause and try to tough it out because it's just menopause. And sometimes that's not always the case. So if there's something that's bothering you, even if you are perimenopausal or postmenopausal for that matter, if it's something that's persistent and bothering you, I would still talk to your doctor about it because menopause can manifest as so many symptoms that can also be warning symptoms for other conditions, whether it's cancer or something else. And so, if you find that you're attributing something to menopause or perimenopause, but it's something that's bothering you and that you're worried about, I would definitely bring it up to your doctor because we would so much rather that you come in with a concern that ends up being nothing than for you to stay home for months and think, oh, this is just menopause, when really it's the sign of something else. So never hesitate to reach out because we'd rather, like I said, we'd rather you ask and it not be a concern than you not ask and lose time in that way.
Gotcha. Thank you so much for that. Okay. So guests, if there are no additional questions, I am going to circle back to our panelists to see if they have any closeouts for us. And then we'll get to our wheel to see who's going to win this gift card for the raffle. So, ladies, any one of you all can jump in to do some closing remarks.
Basically, I just want to say our service is 100% free. So, to make sure that no one, are afraid to reach out to us because they think it's going to be a cost connected to it, to us, please don't feel like you can't reach out. Again, we have all our volunteers right here. I think that I have 5 people on the line. All of them will really be happy to help out. So you don't just have to look for me because I know I'm all over the place. So I thank God for our volunteers. So please, you can reach us at 708-932-9761, or you go to our website that Miss Deb has put in the chat. And we're so glad you joined us tonight. And I'm happy to finally sit at home and talk about what we're doing. We've been running all month. So shout out to all the ladies who's out boots on the ground and getting this information out to the women's in the community, women's and men's in the community. So thank you again for the invite.
You're welcome. Thank you for being here.
I will echo that and say thank you so much, Aisha, for having me. It's been an honor to serve on this panel with such distinguished guests, and I'm happy to answer any questions. I would just say if you have a symptom that's bothering you, to go to your doctor. If you have a symptom that's not bothering you, but you notice is new and unusual, please go to your doctor. And hopefully you all feel comfortable and empowered to speak with your physician about any concerns that you have. And I wish you all the best of health.
Okay,
Leah?
I'll jump in. This Tierra. Let me know if I'm driving, if the sound is too bad. Is it okay?
Oh, you're fine. You're fine.
Okay, so I would just add, if you know anyone who is going through breast cancer, just make sure that you encourage them to keep moving, because breast cancer comes with so many more aftermath and side effects than just losing hair. I mean, I'm done with the bulk of my treatment, and I have neuropathy, so I can't feel my fingertips and some of my toes, and it comes with the disfigurement. It comes with muscle atrophy. So I'm not as flexible as I used to be. So encourage them to get up and move even when they don't want to. So I work through my chemo. I will take off 2 weeks and then work 2 weeks, and I will flip flop like that. But I do a 4 mile walk every day. And even in my illness, I got up and I did that walk. And it made a difference, because I have a little stiffness, but I'm able to do almost everything that I could do before I got cancer. So just stand by your sisters, because it's bigger than losing hair.
Thank you so much for that. That's so
Aisha,
important that you
Aisha,
added that.
let me just and I, just because she added that made me remember when she said encourage someone. So George Walton, one of the things we do have is a support group. So we meet the third Tuesday at TCC, which is on 4351 South Drexel Boulevard. So we meet there from 5 to 7. And then on the first Wednesday of each month, we actually work with we partner with the Blue Door neighborhood on 111th. So you can show up at the center, or you can join us via Zoom, whichever works for you. So we do what we can all the time to encourage the women. So if you know anybody that looking for a support group, please connect them with us, and we'll be happy to encourage them as much as we can.
Thank you for that. I appreciate all of my panelists. You all did an amazing job with sharing information, sharing your personal testimonies. This was just really, really great. Thank you, Dr. Leah, for providing the medical aspect of it. But I just thank you all so much for being here. So we are going to move on over to our raffle. And again, thank you to our participants who are on the line. So please look on here. My wonderful teammate has made sure to put everybody's name on here. And please look, and if you don't see your name, let me know right now before we spin this wheel. Everybody on there? Okay. I don't hear anybody saying no, so we can go ahead and spin. Yeah. All right, and we have our winner is Maymuna. Are you still on the line, Miss Maymuna? Oh, going once. Okay, it was almost gone. All righty, so we have our winner. Thank you so much for joining us, and also just be on the lookout for um, in the follow-up email that I'm going to send out tomorrow. The follow-up email will contain the survey. We didn't put it in the chat this evening, but I will send it out tomorrow. And also all of the resources that were provided this evening. So be on the lookout for that. And just one more thing before we go, I just wanted to pull back up my slides really quickly just to, again, just let you guys know about what we have coming up shortly. So again, I'm hoping that everyone enjoyed tonight's presentation because again, like I said, it's just very important for us to share this type of information with you all. And we're going to, again, by doing it on Zoom, we're able to just reach so many people. So you all also, sign up if you haven't already done so. Please sign up for our weekly newsletter. Well, it's bi-weekly newsletter to stay updated on upcoming events. We have lots of events that are in the community as well as virtual. So, and everything is free, and things like this are free for you to just get this important information. So, it's very valuable and just very accessible. And like I said, we also um, we record it so that you're also able to go back and check it out, share it again. So again, the survey will be presented to you in a follow-up email. And then again, just letting you know about our upcoming high school healthcare career event that we do twice a year. It's just an excellent event. So please sign up. We take grades 7th through 12th, and it's a time for them to come out and learn about healthcare careers and opportunities and bridge programs that they can actually get into now. So, and then also for them to have live demonstrations where they're able to participate in learning how to stop the bleed in case they're in a traumatic situation, learning suturing, learning about airway constriction, and CPR. So this is an excellent event. And just me and one-on-one being able to talk to the medical professionals. So we did the raffle. And again, follow us on social media. We are at UCM Urban Health Initiative on Facebook, Instagram, and YouTube. And this is our information, which will also be in our follow-up email. If you'd like for us to come out to do an event for you in person, we are able to do so. So just connect with us. And again, I just want to thank you all again for your time this evening. I'm so appreciative for everyone who's on this call and especially to my guest. And we hope that you all will continue to join us because again, it's our goal to keep you guys informed on, health resources. We're going to also do a couple of cooking demos, which is, some fun stuff. So we just want you all to continue to show up. And I appreciate every one of you all. Thank you so much. And everyone have a great evening. Thank you. Thank you.